Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates for the Department of Health. Questioning for this department will proceed in a global manner. Before I open the floor to questions, I'm just wondering if there would be leave to allow the opposition to sit on the left side instead of me reading this long script in order so that it would be easier for us to look at the cameras. Is it agreed?
Agreed.
Agreed and so ordered. The floor is open for questions. Oh, sorry, the member for Union Station.
Thank you, Chair. I'd just like to welcome folks back. I know we just had a long weekend and hope everyone had a safe and enjoyable long weekend. I'd like to start by asking the minister some questions in regards to the estimates document that we all had access to, and I certainly went through after receiving it. So the supplements to estimates document identifies a series of risks. That's risk is identified in that document. And a series of treatment plans are proposed in relation to those identified risks. Can the minister give us a clearer idea of what these treatment plans are and when they might be complete, and whether they'll be released to the public when they are complete?
Before I recognize the minister, I'm just wondering if the minister could get her staff to get her a set of headsets that would make it easier for the recorders here to hear what the minister has to say. The Honorable Minister of Health.
Thank you, Mr. Chairperson. I don't know if we have headsets for this particular machine. I don't see that, but we can look into that for future estimate sittings. Mr. Chairperson, I thank the member for Union Station for the questions. I have found the section the member is referring to. I would like to take the member's question under advisement and provide a response to each of those categories as laid out on the pages at a later time, please.
The member for Union Station.
I thank the minister for being willing to take that under advisement. I look forward to receiving those documents. I'd like to ask the minister if she can provide me the budget and the actual amount of dollars spent for community health over the last few years.
The Honorable Minister of Health.
Thank you, Mr. Chairperson, and I thank the honorable member for Union Station for that question. I would like to seek further clarification from the member. Can the member be specific about which years they are seeking the budget and actual information for? Please be specific about the years. Thank you.
The member for Union Station.
If the minister could provide the budget and the actual amounts spent for years 2020/2021, 2018/2019. I think I missed a year there. And then 2019, 2020. So for those 3 years, please.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I'm pleased to respond to the honorable member for Union Station's question. In 2018, 2019, the budget was $348,422, and the actual was $332,892. In 2019, 2020, the budget was $347,472, and the actual was $357,422. In budget 2021, I do want to flag for the member that this was the year that community health and mental health were separated. The new Ministry of Mental Health, Wellness and Recovery was created on January 5th of 2021. So there's a change there. In 2021, the budget for community health is $180,611. And the actual for 2020-2021 is $237,799,000. So if the member is wondering why the decrease in the budget amount for 2020-2021 to $180,611, it's because we it's because we separated that department, the departments. Thank you.
Member for Union Station.
Can the minister provide, thank you to the minister for that response. Can the minister provide clarity then that $180,000 actual, does the minister have access to the information that would tell us how much additional dollars as a result of the change in departments were redirected? So is there any way for the minister to provide what the number would have been had it not been for that addition of the department, or the funds that were redirected into the additional department as a result?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. While we are obtaining the information the honorable member has asked for, I just want to flag for the member that in the supplement, it does show that the dollar amounts that I quoted have 3 zeros. So when I was saying thousands, it's $1 million. I apologize for that oversight. So I just wanted to make you aware of that. Thank you.
The member for Union Station.
I thank the minister for providing that clarification. I did presume that was the case. Otherwise, I would have been shouting and alarmed at the amounts provided. But I am wondering, while we wait for the minister to get the answer to the previous question I asked, looking at these numbers that have been budgeted for community health and also understanding, and the minister is very well aware, that rates of congenital syphilis here in Manitoba and Winnipeg have skyrocketed and steadily increased over the last several years. So, beginning in about, I believe, 2018, we've seen the numbers increase from under 10 to a number for last year, 47, which is, I mean, any number above 0 is high. There shouldn't be a single baby born in Manitoba with congenital syphilis. It is preventable, but certainly Manitoba having 47 cases, which matches the numbers for congenital syphilis for the rest of the country, is deeply concerning. It is astronomically high. And it begs the question, as these numbers increase over the years, have increased over the last few years, we also know that the rates of HIV have also increased. They are also astronomically high. I've heard from many community health providers that they're quite frankly terrified for what this means for folks in our communities who are not only being diagnosed with HIV, babies being born with congenital syphilis, but also they're finding, due to lack of resources, it incredibly difficult to make sure that people are receiving the care that they need to improve their health outcomes. So when I look at these numbers allocated to community health, and we also reflect on the increased rates of preventable diseases, does the minister look at this information and wonder whether or not these funds are adequate? For me, as somebody looking at this and seeing what's going on, certainly it flags for me that no, the investments are inadequate, that they're not addressing the acute concerns we see in community health. So I'm wondering if the minister can provide her thoughts on that. Does she think that the funding her government has provided to community health has been adequate and is going to address the alarming rise in congenital syphilis that we see and the alarming rise in rates of HIV that we see and other challenges like overdoses in our communities?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I'm pleased to respond to the Honorable Member for Union Station's question. Our government, of course, is always monitoring the cases of congenital syphilis. I know that back in February of 2019, under the previous provincial public health officer, we were informed about an outbreak, and we implemented and took under advisement the recommendations that came forward from the chief provincial public health officer at that time regarding the need for more testing. The Department of Health increased the amount of testing that was done, that is being done. There's also treatments available to the baby when it is born with syphilis, antibiotics for up to 10 days, and other treatments may be provided. So we've worked with our current chief provincial public health officer in terms of addressing the requirements they have sought regarding communicable disease control, and continue to have those discussions, Mr. Chairperson, with regard to HIV, AIDS. Of course, our government takes this disease very, very seriously, and we're always actively working with public health to improve the prevention and treatment of HIV and AIDS. And I just want to state for the record that is why we added coverage for pre-exposure prophylactic, also known as PrEP, to the provincial pharmacare formulary, allocating $2.3 million over 3 years to support the development and implementation of an Indigenous-led STBBU testing and contact tracing strategy as well, and extending coverage for HIV post-exposure treatment, and of course, enhancing coverage for HIV treatment for those experiencing financial or administrative barriers. Mr. Chairperson, we will continue to have discussions, as I said before, with public health regarding communicable diseases and how to control those. In terms of overdoses, my honorable colleague, Sarah Guimard, in the Ministry of Mental Health and Community Wellness, now oversees that particular file. But of course, the two departments work very closely together in terms of ensuring that the needs of those who are struggling with overdose addictions is being properly funded and managed, and because individuals certainly will gain access to supports and health treatments at various facilities across the province. So we do work very closely together. Our government continues to monitor the rates of overdoses and deaths from overdoses. And that is why we've established a 5-year roadmap, and we're funding that roadmap so that we can add supports to core services, supports that were often under the previous administration overlooked. That is why our government has added rapid access to addiction medicine clinics. That's why we are making naloxone available to over 120 different locations, Mr. Chairperson. And that's why we're even going further in terms of helping our youth through our new Huddle youth hubs, where they can gain access to primary care, to referrals for addictions, mental health support. So we are focused quite broadly on ensuring all Manitobans, regardless of age, have access to the supports that they need, and we will continue to do so as we move forward as a government. Thank you, Mr. Chairperson.
I'd like to remind the Honorable Minister that when referring to a member, they should be referred to by their title or ministry or constituency, but not by their name. So I'd just like to remind the member. She had mentioned Sarah Guimard. So if the minister could just keep that in mind. The member for Union Station.
Thank the minister for that response. Interestingly enough, the minister talked about steps that may be taken that folks can access after they've been infected with a disease. And so, I mean, it's pretty important that there be a plan in place to address the rising rates of congenital syphilis as one example. This is something that is devastating families, and it is inexcusable that under this government, the rates of congenital syphilis have not only exist, but they are incredibly high. They're markedly high, highest in the country right here in Manitoba. And so my question is, what is the minister doing to bring down those rates of congenital syphilis? What is the minister doing by way of action to prevent babies from contracting congenital syphilis? What steps is this minister taking? What investments are being made? What strategy is in place to bring down the rates of congenital syphilis in Manitoba?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. And I want to note for the record that this is an area that is very, very important to our government as well as our public health officials. Our chief and our deputy chief have stated numerous times their commitment to ensuring that supports are in place, and they continue to monitor the numbers and to have conversations with my department regarding the need to scale up supports in any areas that may be identified. I do want to go back and answer the member's question about the budget in 2021 for community health. The member had asked if I was aware, if I could provide the number for what the budget would have been if before the departments were divided and the new Ministry of Mental Health, Wellness and Recovery was created. That budget for 2021 is $367,697,000. In health, again, the amount that remained in the Ministry of Health or Department of Health, $180,611,000. The amount that went to mental health was $187,086,000. So I will pivot back to the question posed by the honorable member regarding syphilis and just share that we are, as a government and public health, aware of an increase in STBBI cases across Canada. And the government is working with Dr. Roussin, as I mentioned before, in public health to address the issue. One of the things that we have done is we've increased syphilis testing in pregnant women in the province. And pregnant women are now screened multiple times during their pregnancy. We've expanded harm reduction networks and peer advisory councils across Manitoba. Specifically, since 2019, we've provided over $850,000 in increased annual funding to the Manitoba Harm Reduction Network. We've increased the distribution of harm reduction supplies in every health region for things like sterile equipment, including $650,000 in the WRHA, Winnipeg Regional Health Authority alone. We added new public health nurse positions to support STVBI case and contact management and STVBI testing and treatment among priority populations and outreach locations. We have funded new social workers and reproductive nurses at Mount Carmel Clinic to provide on-site and outreach services. And I want to talk a little bit about Mount Carmel Clinic. We did this in partnership with WRHA and Street Connections. In 2019, we launched the Star Lodge Kiwatanuk Ashak Minoy Awagamek to enhance overall community health related to sexually transmitted bloodborne infections, specifically syphilis and congenital syphilis. They are focusing on those who are pregnant or in childbearing years, including their parents and individuals who use substances, and is grounded in culturally relevant teachings and culturally safe approaches. Star Lodge supports low barrier access to STBBI and reproductive health care. And so Mount Carmel Clinic was provided with funding to hire 1.0 FTE social worker outreach worker and 1.0 EFT reproductive health nurse for the project, and the WRHA was provided with funding to hire a 1.0 EFT public health nurse to work in collaboration with Mount Carmel Clinic. Services are delivered on site at Mount Carmel Clinic and by outreach twice a week in the afternoon. Several clients have been engaged in testing, and several prenatal clients as well. And as I mentioned before, we scaled up our harm reduction networks and peer advisory councils. And in addition to the $850,000, WRHA also received $100,000 to implement a harm reduction network full-time coordinator in the WRHA. Other supports in Southern Health, Sante Sud, Prairie Mountain Health, Northern Regional Health Authority, and Interlake Eastern Regional Health Authority as well.
The member for Union Station.
Thank the minister for that response and providing those details. I'm wondering if the minister can clarify the dollars that she's outlined for 2018, 2019, 2020, and 2020 and 2021. Can the minister clarify if any of those dollars, any of that funding, I guess more specifically for 2019, 2020, and 2020, 2021, were specifically to address COVID-related expenditures? And if so, what's the amount, rather, that was specifically allocated to address COVID-related expenses?
Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the honorable member for Union Station for the question. In our annual report, we are being transparent in terms of showing that the 2020-2021 authority included supplementary authority of $600 million from internal service adjustments to support COVID-19 support programs in the department, and that those funds went to acute care services. That is showing in our annual report quite clearly. The member is asking whether the community health dollars that was shared for 2020-2021, if any of those dollars went to COVID. And my answer is that there was separate funding allocated for COVID spending, and that is under the acute care services line, $600 million. Thank you, Mr. Chairperson.
The member for Union Station.
Thank the minister for that response. A couple of weeks ago now, at this point, I raised concerns that we have about long waits for cardiac surgery. I'm sure the minister, like many of us, has received correspondence from Manitobans who are still waiting, who've been waiting years for cardiac surgery, or who, more recently, we shared the story of a gentleman who was just a couple of hours away from receiving surgery and was told, moments before he was meant to go in that it was canceled. So I'm wondering, given the importance of addressing this backlog that we know is affecting so many Manitobans, and also given that we know specifically in regards to cardiac times, the wait in March was 70 days, 70 days long wait in March compared to just 12 days a month before. So that's a pretty big increase. It affects a lot of families. What is the minister doing to address these waits?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the honorable member from Union Station for the question, because it gives me an opportunity once again to thank all our healthcare professionals that have been working diligently to ensure Manitobans receive the surgeries and diagnostic tests that they have been waiting for. And I'm pleased to state that all the healthcare workers that were redeployed to assist in critical care and ICU during our fourth wave and our Omicron variant wave has now returned to their program and clinic areas. And so as of May 24th, there were 1,188 non-emergent surgeries completed the week of May 16th to 22nd at Winnipeg sites, This is a 150 more surgeries than the number completed during a similar week in 2019. So that would be May 13th to 19th, 2019, when 993 surgeries were completed. That means Winnipeg's surgery program operated at 119.6% of pre-pandemic levels last week, Mr. Chairperson. And the number of surgeries completed last week is 45 more than the week before it. This marks a 3.9% increase week over week. Also, all emergent and urgent surgeries, including cardiac and cancer procedures, continue to be prioritized. Non-urgent surgeries are reviewed by physicians to prioritize patients who medically should not wait any longer for procedures to be performed. The number of emergent surgeries performed last week also remained steady as it has throughout the pandemic. There were 185 emergent or life-saving surgeries performed last week in Winnipeg, up one from the previous week. There were 262 surgical slates in Winnipeg last week. This is up one from the previous week. So they're at 95.3% of pre-pandemic baselines. And I just want to remind the honorable member that the number of surgeries performed during a slate will vary widely depending on the acuity of the patient and the complexity of the procedure. So for example, an endoscopy will not take as long to perform as neurosurgery. And the time allotted for surgical slates in 2022 may vary from those performed pre-pandemic due to demand resulting in fewer surgeries being performed. And of course, COVID has also resulted in some slowdowns in terms of infection and prevention control and what needs to be done to ensure a room is prepped and ready for the next patient. But with respect to the member's question about cardiac surgeries, 21 cardiac surgeries were performed May 16 to 22nd, which is unchanged from the previous week, but all 21 surgeries were non-urgent, elective in nature, and there were 17 cardiac surgeries performed during a similar period in 2019, 13 non-urgent, elective, and 4 emergent. And in terms of rural surgeries, because we don't just want to focus on what is happening in the city of Winnipeg, but surgical slates are at or near baseline funded capacity at most of our sites outside of Winnipeg. And surgical slates were restarted in St. Anne on May 10th. And we continue to support other sites such as Bethesda Regional Health Center in Steinbach. Effective May 30th, they are also supporting St. Anne in terms of ensuring that any overflows or any needs from the St. Anne Hospital are being transferred to Bethesda Regional Health Center in Steinbach. And so they're continuing to ensure equity in healthcare services. So we continue to work with our cardiologists and the Diagnostic and Surgical Recovery Task Force to ensure Manitobans receive those cardiac surgeries and are not having to wait for long lengths of
Minister's
time.
time has expired. The member for Union Station.
I'm sure the minister is aware and understands that referencing surgical number of surgeries that have been performed and identifying that the numbers, most recent numbers she provided that she has available are the same as they were during that time period in 2019. I'm sure the minister understands that that is actually reflecting an inadequacy in terms of the amount of surgeries that are being performed right now, given the fact that we have an unprecedented surgical and diagnostic backlog. And so, I would hope that the minister would recognize that and appreciate that certainly we have to be performing above and beyond what we have historically in order to address this backlog in a way that doesn't continue to see thousands upon thousands of Manitobans have poor health outcomes because they've gotten so sick and gone without the care they need that their diagnoses becomes that much more complex. I had an interesting conversation with a few surgeons last week who made it abundantly clear that the surgeries they were performing are increasingly more complex and taking longer, and quite frankly, taking a lot more out of them as doctors, as surgeons, because the cases are increasingly complicated, because folks are presenting much more sick than they would have had they gotten their procedures and their surgeries much earlier on and not been delayed by this backlog that is astronomically high right now in Manitoba and has unfortunately not been addressed in a meaningful, adequate way by this government. And so that's just a flag for this minister that, you know, comparing those numbers really doesn't do a service to Manitobans who are still waiting for their surgeries. And it doesn't reflect the ways in which we really need to be addressing this backlog for folks to not continue to wait in pain. What I'd like to clarify here is whether or not the minister has taken steps to address the wait for cardiac surgery. She failed to answer that in her question. It was 70 days in March. What steps has she taken to bring that wait time down? And following that, I'd like to ask the minister some questions about Grace Hospital, but if she could provide clarity on that point, I would appreciate it.
The Honorable Minister of Health.
Thank you, Mr. Chairperson, and I want to be sure I have time to clarify and put accurate information on the record with regard to the member's statement that individuals are having to wait 70 days. But before I do that, I do want to state that since January, we've had 13,323 non-emergent surgeries completed, 3,604 emergent surgeries completed for a total of 16,927 surgeries. That this is in addition to the 11,000 surgeries procured by the task force through requests for supply arrangements. So this is in addition to returning, as I mentioned before, to pre-pandemic levels. And we have sent out the RFP for our sixth request for supply arrangements so that we can increase those volumes. And so with regard to cardiac surgery, we need to clarify that wait times are reported for all cardiac surgeries combined and for coronary arterial bypass grafts, commonly referred to as bypass surgery. So it's broken down by level of urgency: emergent and urgent, semi-urgent, and elective. So the information provided that the member is referring to is for all cardiacs combined. The median wait time was 70 days. But if we break it down by the various levels of surgeries, so for example, emergent and urgent, the average is 4 days. And in terms of priority level 1, it's required to be done within 14 days. So these are critically ill, medically unstable patients who cannot be discharged from hospital prior to receiving care. And level 2 is semi-urgent. The average time is 20 days. And for semi-urgent priority level 2, the wait time should be within 15 to 42 days. And these are patients with significant heart health problems. They may be doing poorly on medication and or may have pain with minor exercise. These patients are not critically ill, but waiting too long could result in a deterioration of their health status. And then there's level 3, which is elective. The average time is 63 days, but elective priority 3 is required to be done within 43 to 180 days. And these are patients who are stable but have some form of heart health problem. Their procedure may be scheduled after a wait time without undue deterioration in their health status. So the 70 days the member is referring to is the average for all cardiac surgeries combined. Again, level 1 average is 4 days. Level 1 is emergent and urgent. The wait is 4 days. Level 2 semi-urgent is 20 days. Level 3 elective is 63. And for all coronary arterial bypass grafts, the number of days is levels, it's 45 days. So I just wanted to clarify that, because we certainly don't want to frighten Manitobans into believing that if they are emergent and urgent, they will be waiting 70 days. So these are critically ill, medically unstable patients who cannot be discharged from hospital prior to receiving care. And everyone that requires a surgery is important. I certainly don't want to give the impression that if you're an elective cardiac patient that you're not important. Our emergent and urgent priority level 1 is important. Our semi-urgent priority level 2 is important. And our elective priority 3 patients are also important, Mr. Chairperson. But I think it was factually incorrect for the member to just state the number 70 and to leave that number in the minds of Manitobans who may be waiting for surgery and feeling that, again, if they're emergent or urgent, they would be waiting 70 days. That is factually not correct.
The honourable member for Union Station.
I thank the minister for that response. Out of respect for the many Manitobans who are currently waiting for cardiac surgery, I'm not going to get into the weeds of what the minister just put on the record. I think it does a disservice to those folks. We shared the story of Mr. Moyes, who has been waiting years for his surgery, has a heart functioning capacity at 30%, was mere hours away from getting his surgery and was told it was canceled. The wait times being on average in March 70 days, hearing stories like that of Mr. Moyes certainly should be a catalyst for this government treating this as a crisis in our healthcare system, to see this as urgent. And so the facts that we have put on the record in regards to cardiac surgery waits are important facts that reflect the realities of Manitobans. And I won't contribute to this narrative from the minister of trying to diminish the realities that Manitobans are facing. It does them a disservice. I'd like to ask a question around the Grace Hospital. I just indicated previously to the minister I would be doing so. What we're hearing in terms of what's going on at Grace Hospital is quite scary. We've been hearing for well over a year now, myself, my colleague, the MLA for St. James, our leader, the member for Fort Rouge, we've all heard from many staff at the Grace Hospital, from constituents who have accessed care at Grace Hospital, that things there are in utter chaos, that nurses, healthcare aides, doctors are working in conditions that are, for them, horrific, and that Manitobans are experiencing what Manitobans should not expect in their emergency rooms and in their hospitals, which is disarray, folks reporting languishing in hallways, going without water, without anyone checking up on them for hours, sitting there for days on end. This has been a crisis for far too long. The minister and her government refused to call it a crisis, refused to take meaningful steps to address the crisis, and now we're beyond that point at Grace. We know that at Grace Hospital, and we know this because we had obtained staff schedules, that there are times when only 2 or 4 nurses are staffing the emergency room at night. We've highlighted the staffing crisis in the emergency rooms for years. We've highlighted that there are 2,400 vacant nursing positions in the province right now. 33% of positions are vacant in emergency rooms, 32% vacancy rate in the medicine unit. Manitobans should be able to go to an emergency room and get the care they need when they need it. They should be able to expect that, and they can't, and quite frankly, they don't. What is the minister doing to ensure that staff resources at Grace Hospital for nurses, not just not this plea for anybody to show up and put in some hours there, but what is this minister doing to ensure, to shore up nursing capacity at the Grace Hospital to address this horrific crisis that they're facing right now?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the honorable member for Union Station for the question. It gives me an opportunity to just place on the record some information about how we got to where we are today. And Mr. Chairperson, I remember back in 2013 when then Salinger government campaigned on the highest number of active nurses. And what they didn't tell Manitobans was that at that time, 2013, there were 1,777 nurse vacancies. And so they were warned that there was a crisis. And so 13 years ago, again, a warning. The alarm bell was rung with regard to the deficit of registered nurses. And that was in a report authored by the Canadian Nurses Association of a projected deficit of 60,000 registered nurses nationwide by 2022. So the NDP were told of this, and Manitoba's share of the deficit was estimated at 2,160 nurses, and that was before the pandemic, Mr. Chairperson. And what did the former NDP government do when they were told it was time to begin to steer the ship away from the staffing crisis in the early 2000s? Nothing, Mr. Chairperson. Under the NDP's tenure, there was a clear lack of expanded the nursing, RN, and LPN program capacity. What our government has done is we've acted. We've added 400 new nursing education seats to 5 post-secondary institutions, and this change doubles what the NDP had in 2000. And we're also graduating 15% more nurses on average than the NDP ever did. And again, the $7.2 billion, the largest healthcare investment in our province's history as well, Mr. Chairperson. With regard to Grace Hospital, the wait times are concerning. Again, I want to state that the health system leadership has acknowledged the challenges they've experienced, not just at this health facility, but at others. And the solutions are coming forward from the hospital floor, which include a $1.2 million expansion supported by our government of the physician and triage model of care. This pilot program places a physician in the triage area to manage and provide care for those waiting to be seen, with a particular focus on higher acuity patients, Mr. Chairperson. And we're also improving lab turnaround time for patients requiring admission, which will significantly help with COVID testing, and as well the level loading of transport arrivals across all sites to try to alleviate some of the pressures on Grace and our other acute care facilities. And we expect that these initiatives will have success in reducing the wait times in the weeks ahead, which are some of the pressures that Grace Hospital is experiencing. And then our government's overall commitment to our nurses. 93 nurses in the last year have completed the 12-week critical care orientation program, 23 of which graduated in January. 29 more nurses will graduate from this program this month. 19 have enrolled for the next program class that started yesterday. And we are going to be graduating more nurses from our Faculty of Nursing later next month. We continue to our commitment of the $19.5 million, again, to add 259 nurse training seats this year. And those nurses don't just go to work in one facility. We encourage them to apply to work across many facilities. We hope to see many of those nurses at the Grace as well, and we'll continue to support the work of the health system leaders at the Grace.
Minister's time has expired. The member for Union Station.
So, because this is such an incredibly urgent issue, what is happening at Grace Hospital has gone beyond a crisis. And those nurses and healthcare aides and support staff and physicians desperately need to know that their Minister of Health and their government is listening to them. They need to believe and they need to know that they haven't been abandoned by this government and by this minister. And so I'm going to ask the minister again, knowing that nurses are actively leaving their careers in Manitoba, because they have PTSD, knowing that nurses are actively leaving their jobs, which they love, which they have poured time, energy, money, and love into working, because they fear losing their licenses, knowing that nurses are leaving because other jurisdictions, other provinces are offering them what this government has refused to recognize their skill set and their service, knowing that nurses have made very clear that their concerns and their challenges predate the pandemic, that nurses at the Grace were sounding their alarms and raising concerns back in 2019. That goes for nurses at HSC and as well nurses at St. Boniface. But specifically at the Grace, I would ask the minister to, in her response to my question, think about those nurses and those healthcare professionals and what they need to hear from this minister. What steps is the minister taking right now so that the staff working at the Grace Hospital emergency room do not go into work every day feeling like they're drowning? What is this minister doing right now to ensure that they have the capacity there to provide the care that Manitobans deserve and should come to expect when they're accessing that emergency room? What steps has this minister taken or is taking immediately?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. And, I want to begin my response by saying this is in no way a reflection on the committed and dedicated healthcare professionals at Grace Hospital. They are doing incredibly great work, and our government is committed to supporting them and hearing from them through our health system leaders. And as I mentioned before, some of the suggestions that have come forward have been implemented. But I noted in today's Winnipeg Free Press that the author of an article stated that hospital overcrowding is not a new phenomenon. It predates the COVID-19 pandemic and Manitoba's Healing Our Health System consolidation plan, the first phase of which was implemented in October of 2017. And it even predates that time period. I have articles dating back to September 19th, 2014. The CBC article headline was Winnipeg's Grace Hospital has worst ER wait times in Canada study, and that was under the previous administration. And then June 11th, 2015, another article, Winnipeg Hospital wait time, the worst in Canada. So this has been a struggle. It's not based on a government. It is challenges that they faced and we face as a government, and we're certainly committed, far more committed to finding solutions, I believe, than the previous government. And if I can read into the record an exchange that occurred on June 9th, 2015, between the health critic and the then Minister of Health, Sharon Blady. And I quote, Mr. Chairperson, and the questions being posed by the critic. Mr. Speaker, there's an ER crisis, and there are also regions in Manitoba. There are regions in Manitoba that are experiencing a critical doctor shortage. Because of that, 24 rural ERs are closed. When asked in estimates yesterday how she was going to address this issue, this Minister of Health said that she's still waiting for and I quote, magic healthcare wand. I would like to ask her, since last evening, did she find that wand? End quote. And that is how the NDP addressed the concerns and the issues of emergency room crisis. Was for a health minister to state that they were waiting for a magic healthcare wand. But Mr. Chairperson, our government is certainly not as dismissive of what is happening in our hospitals and our emergency departments as the previous NDP government. And that's why we've made the commitments that we have. The $19.5 million for 259 nurse training seats, expanding to 400. I was up in the north last week talking to health leaders, service delivery organizations, stakeholders, touring the nursing simulation lab, hearing that the number of nurses that will be graduating this spring from the University of Manitoba Faculty of Nursing. Very heartened to hear that there are nurses across our province that will be moving into the system, and hearing as well from the regulators that the number of nurses that are registering in our province has not decreased. And so nursing continues to be a rewarding and fulfilling professions. We continue to support our nurses regardless of the facility that they work at. We will support our nurses at the Grace Hospital. We will ask our system leaders to be on the front lines, talking with staff about what are the needs, how can we work together to find long-term solutions. That is being done. I've been assured by shared health leadership that those meetings are taking place. When suggestions come back to our government, we are funding those solutions, and we will continue to support Grace
The Honourable
Hospital.
Minister's time has expired. The member for Union Station.
I think it's fair to say that the staff, the healthcare support staff, the allied healthcare professionals, nurses, healthcare aides, physicians at Grace Hospital would not be inspired by that response from the minister. It certainly doesn't instill confidence that she's taking this crisis, what it is beyond a crisis at this point, as seriously as needed in order to make sure that those folks have increased capacity to provide the care to Manitobans that they know Manitobans deserve, which is disappointing, quite frankly. Like the concerns of those healthcare workers at Grace Hospital, those concerns we previously raised, we've also raised our concerns with the minister about the neurology program. I know this is something the minister is well aware of. I've had several colleagues in our caucus raise concerns that have been brought to them by their constituents. Folks, neurologists themselves have spoken publicly about this issue. Can the minister tell us what the number of vacancies and the vacancy rate currently is in the neurology program?
The Honourable Minister.
Thank you, Mr. Chairperson. I thank the honorable member for the question about neurology. I do want to state for the record that our government remains committed to improving healthcare for all Manitobans, and that includes strengthening neurology services and care for patients with multiple sclerosis, epilepsy, as well as improving our stroke services. Recruitment and retention of neurology physicians and staff remain a priority. 6 new neurologists have been recruited to the neurology department over the past year. This includes 1 MS neurologist, 2 epilepsy neurologists, 2 stroke neurologists, and 1 cognitive neurologist. Support staff has also been recruited. Hospitalists have also been recruited to support inpatient work in neurology and stroke care, providing important patient care while freeing up some specialist care for more specialized services. I want to also just share about epilepsy. Our government announced $4 million in support for a 4 adult bed epilepsy monitoring unit, which underscores our commitment to improving neurology services in our province. This investment allows the adult epilepsy monitoring unit to expand to 4 beds from 2, and the purchase of new state-of-the-art monitoring equipment, as well as provide technology-related upgrades. We are also committed to a long-term plan to develop an adult surgical program. The expanded adult unit follows the creation of a pediatric epilepsy surgery program in 2018 by our government. And with regard to stroke, looking forward to announcing very soon the construction of Manitoba's first dedicated acute stroke unit. And funding to appropriately support this new unit will also be in place when I announce the opening, and I look forward to sharing more about this investment with all members of the legislature very soon. Thank you, Mr. Chairperson.
The member from Union Station.
Can the, I think I should provide some context here. It's context the minister's already aware of, but Dr. Dan Roberts, who I know the minister knows, is well aware of who Dr. Dan Roberts is, has called the situation regarding neurology here in Manitoba, and it's a direct quote, desperate, and a slow-moving train wreck, and that we face the closure of the MS clinic within as little as 90 days. Those are very serious statements from a leading voice in this area, somebody who's highly regarded and respected. And so with that in mind, with just how serious this is in mind, and the reality that, according to Dr. Dan Roberts and others, that we're facing the closure of an incredibly important clinic here in Manitoba in as little as 90 days, can the minister tell us what she's doing to address this incredibly urgent situation?
The Honourable Minister.
Thank you, Mr. Chairperson. I do want to assure the member for Union Station that the comments that I read into the record are aligned with shared health comments in regard to the request to provide a response to Dr. Dan Roberts' media availability last week, and to just reiterate or to share for the record what that response was is our government remains again committed to improving healthcare for all Manitobans, and that includes strengthening neurology services and care for patients with epilepsy, as well as improving our stroke services. Again, our government is supporting shared health in their efforts to strengthen neurology services and enhance local access to care for patients, including those living with epilepsy and MS. Our government implemented new initiatives to enhance neurology services in our province, including the Adult Epilepsy Monitoring Unit announced last year, and the new dedicated acute stroke unit being constructed at HSC Winnipeg, and again, for which funding will be in place to appropriately support when it comes online. Shared Health has recruited an MS neurologist, two epileptologists, two stroke neurologists, and a cognitive neurologist, including support staff, over the past 18 months. Additionally, physicians have been recruited to support inpatient work in neurology and stroke care, providing important patient care while freeing up some specialist care for more services. An interprovincial agreement has been signed with the BC Institute of Technology that provides 2 EEG seats for Manitoba students, and an increase in the clinical stipend for MS physicians has been approved. Thank you, Mr. Chairperson.
The honourable member for River Heights.
Okay, yeah, my question to the minister is this. What is the situation with regard to electronic medical records across the province? I know there was a wide variety of systems that when Southern Health was formed, there were 2 different systems being used. What is the situation and what is the minister's plan?
The Honorable Minister of Health.
Thank you, Mr. Chairperson, and I thank the honorable member for River Heights for the question with regard to electronic medical records across the province. With the change in the movement of digital health from e-health under the Winnipeg Regional Health Authority to shared health, this has allowed us to plan provincially. So we use the term planning provincially, delivering locally. Of course, individual physicians may decide to use other records. One of the examples I use quite often is that right now the Diagnostic and Surgical Recovery Task Force, in terms of gathering information on various surgeries, is having to go individually to surgeons' offices because some are using different systems. And so they do have ability to make choices about which systems they want to use, but certainly as a government, as a province, we're using the expertise of shared health now that we've transferred digital health to shared health to try to encourage those physicians to work with us in terms of planning provincially. So some examples of how that has been done is with the emergency department information system, and as well the surgical information system that is being worked on or developed under the Diagnostic and Surgical Recovery Task Force is being done on a provincial scale. So as well, during the COVID-19 pandemic, there were opportunities to allow for access to emergency medical records provincially so that we could plan, we could roll out our vaccine campaign, not just regionally, but across the province, and really monitor the number of vaccines that were going into arms during that time. So the plan is to address specifically the member's question is to continue to support the work of shared health and digital health that now comes under shared health, to plan provincially, ensure that we have consistent medical records that can be accessed at various levels of the health system. Thank you, Mr. Chairperson.
The Honorable Member for River Heights.
Thank you. I notice in the Shared Health Strategic Plan, there is a plan for a home care hub. Is that up and running, operational? How many people are staffed there? And what is the plan for what the home care hub will do?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. Can I ask for clarification or for the member to repeat the question, please? I didn't hear his voice kind of trailed off at the end, so I didn't hear all of that. Thank you.
The Honorable Member for River Heights.
On page 15 of the Shared Health Plan or Strategic Plan, there's a reference there to a home care hub. And I'm asking, what is the hub up and running or not? How many staff are in it or will be in it? And what is the plan for what the home care hub for the province will do?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I do want to go back to a previous question that the honorable member for River Heights had asked, and we had run out of time during Committee of Supply, and I do want to respond to it. It was a question about who provides primary prevention for diabetes and who provides secondary care for diabetes. And I want the member to know that primary prevention is done under the Ministry of Mental Health and Community Wellness. Secondary prevention in diabetes care involves reducing further complications related to diabetes, which means that once someone is diagnosed with diabetes, they are at a higher risk of developing renal, ophthalmic, cardiovascular complications. So secondary prevention in diabetes care may include, and which might fall under the Ministry of Health, early diagnosis, education on diabetes management and care, including monitoring glucose levels, and ongoing support for lifestyle modifications, including diet, exercise, and weight loss, smoking cessation therapy and medications, managing cholesterol, blood pressure, and blood sugars using lifestyle modifications and medications, use of preventive medications to assist in preventing vascular complications, as well as vaccination, including COVID-19, influenza, and pneumococcal vaccine, as well as regular eye exams, regular foot care, including assessment for neuropathy. With regard to home care, we were pleased to include in Budget 2022's budget speech that $7.2 million more is being provided to support 2 home and community care modernization pilot projects, the Priority Home and Client-Directed Funding Pilot and Supportive Housing Pilot, Mr. Chairperson. This is to provide more safe spaces for seniors and to improve home and community-based care. So we continue to work very, very closely with our home care program and support the work of the program. Shared Health is launching a number of initiatives to continue to support home care, because we know that being able to allow Manitobans to return home when they're in an acute care setting or they've had surgery or stay in hospital is very important in terms of their recovery and as well in terms of patient flow. So yes, home care is working very closely with Shared Health, and they do have in their strategic plan several initiatives that they will be undertaking with the home care program. Thank you, Mr. Chairperson.
The Honorable Member for River Heights.
There are a number of important prevention initiatives, including what we talked about earlier, congenital syphilis and tuberculosis, which are infectious diseases, and in environmental issues, lead toxicity leading to behavioral and learning problems in kids, and radon problems leading to lung cancer. Can the minister tell us what is the respective role of the Department of Health in these, because to some extent it's shared between the Department of Health and the Department of Mental Health and Wellness, and what her department is doing?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. So public health is the subject matter expert, and we seek advice from public health. We certainly don't duplicate. We collaborate, and so with regard to the member's question, the two departments work very, very closely together. But then we work as well with public health and many other departments on this very, very important work. So again, agriculture.
The hour being 5 p.m., committee rise.